You're watching Sky News, a special programme now in which we try and answer some of your questions about the coronavirus outbreak.
Well, COVID-19 has now spread to more than 90 countries with more than 110,000 people infected.
Well, here to answer some of your questions, we've got a panel of experts. Joining us from Glasgow, Iain Campbell, Secretary General of the Independent Health Professionals Association, also a practising physician too.
From central London, we have Nick Trend, Deputy Head of Travel at The Telegraph.
And here in the studio, we've interviewed him several times on this story, Mark Fielder, Professor of Medical Microbiology at Kingston University. Welcome to you all. Iain Campbell, let's start with you if we can. We have a question from Helen, who simply says, "Hi, I have asthma and no immune system, but have had the flu jab. Will that flu jab help?"
So one thing to be clear of here is that influenza, which is what the flu jab protects you from, is actually a different condition, a different family of viruses, essentially. So no, it is prudent to get it because the last thing you would want is to catch two infections simultaneously. So
is that even possible, Iain?
Suggest
is that even possible?
if you definitely get it. However, it is a different virus. So from the point of view of the COVID-19, it's not going to offer protection from that per se, but it's certainly going to make sure that you don't catch two things at once, which is always wise. People with asthma are in a higher risk group as well. We have identified that, and therefore it's also wise to take a special precaution if you are someone in that situation. And those are just the standard advice: washing hands, avoiding unnecessary contact, sort of social distancing, all the sort of advice that you're hearing and I've been seeing on Sky News actually from other parties.
Yeah, OK, Iain, thanks for that.
The next question, I think, is probably one for you, Mark, here in the studio. Hanson on Twitter says, "I bought a toy from eBay from Wuhan in China. I haven't opened it. It might have coronavirus on it. Is this the right thing to do, or am I being a bit over the top?"
A bit over the top. I think it might be a bit harsh on himself, but I think it's very, very unlikely there'll be a problem. There's no evidence of packages and parcels holding the virus and containing the virus. Depends on how long you've had it, but I would imagine it's been in transit for a while, plus you've been looking after it for a while, so I would imagine there's no risk. But I would imagine now you could probably open it, and if it's a washable item, wash it, or perhaps give it a wipe over with some alcohol wipes, just to be absolutely sure. But I wouldn't be concerned. Because
the virus can live on hard surfaces, but only for a number of hours, is that right?
Yeah, it's about 24 hours at the most, really. So it will have taken longer than that to get from Wuhan to Britain or to Europe.
Lots of people thinking hard about their travel plans right now. Jerome on Twitter asks, what does the current FCO advice mean for travel insurance, etc.? Can I actually now, if you want to, cancel a visit to Italy and get their money back? Nick Trend, thoughts on that cancellation policy?
OK, well, it depends how you've booked. If you've booked with a tour operator, the advice means that that tour operator has the duty of care to look after you and must allow you to cancel or reschedule your holiday. If you've simply booked an independent flight and a separate hotel, you're not in the same position, I'm afraid. Some travel insurance policies will cover you, but if yours doesn't, then you may have to rely on the goodwill of the airline and the accommodation supplier to refund you, I'm afraid.
And Nick, I suppose it's one thing when, for instance, it's Italy, that's in the news, people appreciate there's a crisis there. I mean, the advice we've had from clinicians recently is actually you've got a bigger problem. For instance, if you go to, I don't know, say Nepal in the summer, you've got a holiday booked there, you can't know now whether the moment you go in July, for instance, Nepal might find itself in the grip of the most dreadful peak of the crisis with a health system which, frankly, is not certainly of a developed world standard.
Yes, I mean, that is a problem. There are some specialist tour operators operating to China at the moment, which is essentially closed to visitors who haven't yet cancelled holidays already booked and due to depart in April. So I'm afraid it is a waiting game. But if you're thinking of booking, I think this question of the standard of health care in the country that you're expecting to go to is a very good point to make. You might want to think about that when you're booking holidays in the near to medium term.
OK.
We've had another question from Chris W. This is a one for you, Iain, our physician here. How will the coronavirus affect people with MS and on powerful disease-modifying drugs, those kind of drugs that lower the immune system? Are they more at risk?
anyone with an impaired immune system and people on any form of DMARDs, these are the immune suppressing drugs that we use for some rheumatic diseases, yes, would be at higher risk. Again, special caution would probably be merited for these people. In terms of if you catch it, the things which increase your risk most are actually, as I've said, asthma, but also diabetes and chronic kidney disease. These are the ones that we've identified from the limited data we've got as being the sort of highest risk groups if you do catch it. Obviously, you will be doing the same safety precautions as we'd advise anyone else to take. But if you are on these drugs, obviously your immune system will not be quite as good as an immunocompetent, someone with a normal immune system. And therefore, yes, you would be advised to take special caution, I think. And that means just following the advice that you are seeing everywhere about washing your hands carefully, about avoid social distancing, and special caution with people that have, for example, been to areas we know there's an outbreak. So that sort of thing, essentially. But yes, in short answer to your question, I would be more cautious if I were on such drugs, certainly.
And is that advice the same as we've heard for people who are perhaps having cancer treatment, people who might not specifically have MS, but just generally are perhaps more under the weather than the rest of us?
Absolutely. Anyone who doesn't really have a normal immune system, that even includes people with diabetes immune system, they're a wee bit more at risk of certain infections. But also, as you say, cancer treatments or chemotherapy and things like that can make you slightly more at risk of all sorts of infections. And it is therefore prudent to exercise special caution. That said, I think we should all really be thinking about these sort of measures, and not just from our own point of view, from a sort of society at large point of view, because these are also measures which will reduce the risk of passing things on. So we often think about the person themselves trying to reduce the risk by doing all these sort of things. People like that are around us everywhere, and we all have a duty to sort of try to reduce the spread. And if we're doing that, we will be protecting these people as well.
OK, thank you.
Mark, Iain was saying that it is possible to have two flu-like infections simultaneously. There we go, we've established the depth of my ignorance. I didn't realise that was possible. But the more common question, the one that I'm sure you're getting asked a lot, once you get it, do you always develop immunity? That's from Natasha on Twitter.
As long as your immune system is competent, the evidence so far is that you do develop an immunity. And I think this question's come up because there's been a couple of questions about people testing positive once they've tested negative. And there's questions around that about were people swabbed properly in the first place? Are we seeing the natural biology of the virus such that it disappears apparently and then re-emerges? Because we are learning about this. I mean, I think we shouldn't forget that 2.5, 3 months ago, we didn't know about this virus. And now we're almost being in a situation where we all want to know everything. So we're learning a lot as we go along. So the evidence so far is that, yes, you do get immunity, and that immunity should be protective, but we've got to make sure we understand just exactly when you're negative and when that comes along.
And just on testing, since you mentioned it, I mean, there's lots of things about coronavirus which seem to be less good than we might have hoped. But on the testing side, that does seem to be something that's achieved fairly simply, fairly cheaply, fairly emphatically.
I wouldn't say necessarily it was cheaply, but it has been certainly achieved very quickly. Certainly there's one molecular test that's being used in the UK that was co-developed with Public Health England here, with a group in China, I think Hong Kong, if I remember correctly, the Netherlands and Belgium, and that's been working very well as what we call a nucleic acid test. So it's actually looking for the genes of the virus. One thing we haven't got yet is a serological test. So that's where we've got antibodies to the organism, which is a commonly used test. We haven't got that yet because it's so brand new, we haven't got the serum yet. So we're using DNA tests or RNA tests to look for the nucleic acid of the virus and see if we can find that in patients. And that seems to be working very well.
OK.
Another question about travel. So this one's for you, Nick. It's come from Carl. He asks, why is the government allowing travel to and from coronavirus hotspots only for them to return and spread it to the UK?
Well, that's a very good question. It was a very good question yesterday when Italy announced the lockdown in Lombardy, and the FCO advice was updated yesterday morning at 8 o'clock, and it didn't advise against all but essential travel. That has now changed. And I don't think it's true to say before that the government was recommending or allowing travel to actual hotspots. But it was very, very slow, I think, yesterday to adapt to a sensible position on those parts of Italy, which suddenly became restricted on Saturday night.
And a linked question as well. I mean, why don't we just shut all airports for a month?
Well, I guess we could do, but whether or not that would stop the virus spreading anyway, I think Professor Fielder will know much better than me. But it seems pretty sure to me that the infection is in the community generally, and shutting down airports would be hugely disruptive to trade, business, and people who had to travel for family reasons or whatever. I'm not sure the cost-benefit analysis would bear that out as a sensible thing to do. I think we need to probably keep functioning and deal with the outbreak as best we can as it spreads through the community. But Professor Fielder would know much better.
Briefly, Professor, is there any point to shutting airports?
I think we've got to be cautious. Italy closed the flights from China. That clearly hasn't worked. So we need to. I think what my colleagues just said is much more sensible. We just keep our eyes on the battle and make sure we carry on doing the containment as we're doing and move into delay if we have to.
Great, thanks very much.
This is a special coronavirus Q&A session coming up. Is it safe to send children to school? That's one of the several questions I'm going to bring you, hopefully, some answers to very shortly.
Welcome back to our special programme on the coronavirus outbreak. We're answering your questions with an expert panel.
They are Iain Campbell, Secretary General of the Independent Health Professionals Association, who's joining us from Glasgow. As you see, we've also got the Telegraph's Deputy Head of Travel. That's Nick Trend, who's in central London.
And in the studio, Mark Fielder, Professor of Micromedical Biology at Kingston University. And Mark, we'll turn to you with the next question. And it's about a baby's immunisation. My baby's 3 months old. He hasn't had all his vaccinations yet, won't have a very strong immune system. If he catches the virus, is he safe?
It would appear at the moment from data that's coming in that children are remarkably unaffected, and especially the very young. So there's lots of questions about why that might be, and I don't think we fully know the answer yet, but it does appear that the infection rate and very pleasingly the morbidity rate, the death rate rather, is very, very low. In fact, I think if I remember correctly, 0 to 9, it's 0%. So children seem markedly unaffected. And that may be because they haven't got some of the receptors they need to bind the virus, which is a good thing. It may be for other reasons, but children are markedly unaffected. So whilst maintaining the hand washing method and message and the cleanliness message, I think children should be relatively safe.
In a word, and rather selfishly, does that include kids with asthma?
I think then we're into the realms of having people with underlying health conditions. Okay. So I think on the air of caution, our physician colleague might answer this better than me, but I think we would look more carefully.
Okay. Yeah.
I was just going to put that to Iain, because lots of people have asked for clarifications about what are these underlying health conditions. Is it the groups that we were talking about earlier?
Exactly, the groups we were talking about earlier, and I would echo my colleague's comments there that all the evidence we've got thus far, and it's obviously this is an emerging new infection, but all the evidence we've got thus far suggests that children are in a far lower risk group. Indeed, what we see with most conditions, not this one, is that parents often catch them from their children. What we're seeing in this condition is the other way around. We're seeing that it's often parents catch it first and give it to their children. And even then, children tend to have very mild disease, often even asymptomatic. So I guess what I would say is, thankfully, they're in a lower risk group.
Iain, we'll just come back to another question in just a moment, but just a line from the COVID meeting that's been happening today. The Prime Minister's spokesman says the PM chaired the emergency COVID meeting, discussed a range of steps which could be introduced to contain and delay coronavirus. This, I suppose, is a significant line. It says we remain in the containment phase, but now it's accepted that coronavirus will spread in a significant way. We remain in the contain phase. That's the headline there. Iain Campbell, just back to you. We've got somebody asking whether a swimming pool poses any risk. If you go swimming, is the virus something you can pick up there?
So I think it's very much we're not 100% certain of all these things. Hard surfaces are more of a risk, so I might even be more worried about some of the fixtures around the swimming pool than the swimming pool itself. The worst thing about all this is that you are infected when you can be mildly symptomatic or asymptomatic. So many people could be going to these places and touching things without necessarily sort of being aware that they are shedding the virus and leaving it behind in things they touch. That said, I suppose a swimming pool is in many ways like taking a bath. So in some ways, it might even help to rinse some things, also some
I'm hoping that signal's not frozen, Ian. I was just going to ask you how long you think the
fixtures and things like that people have touched around you.
Yeah, we just our bandwidth isn't quite up to muster at the moment, so you're just freezing a little bit there, Ian. I was just going to ask about the period in which people can be asymptomatic for. Do we have a sense yet of how long you've got it, but you're not actually you may be spreading it, but symptomless?
What we're seeing is roughly up to 2 weeks is the kind of normal thing. There are outliers. I mean, I think there was one case up to 27 days that we've seen so far. However, 2 weeks is broadly where most of the consensus is. Some people, it can even be just a few days. I don't know if my microbiology colleague will have more to say on that matter, but that appears to be what we are seeing. Roughly a kind of 2 week lag period before we can be sort of relatively certain that someone's come from a high risk area is not going to develop it, and that's certainly where the guidelines currently seem to sit.
Well, Mark, you're nodding here in the studio,
in
total agreement. Let's get another travel question to Nick Trent from The Telegraph. What am I right if my employer wants me to travel abroad for business meetings, but I'd like to avoid airports and flights as I'm quite worried about it? Can I refuse to go?
Well, that's more of an employment law question, I think. I actually don't know the answer to that. Certainly your employer would have a duty of care, so I think you'd have a fairly strong argument, and I think it would be unusual if an employer were to insist in that situation, but I would talk to your union if you're a member of union. I mean, one of the other problems which has come up recently is if you're booked to go on holiday and you decide you want to go on holiday, but your employer wants you to self-isolate after you return, that's another area which is causing potential problems. And to be honest, I'm not sure if there is any legal clarity over in these cases. And I guess everyone's just going to have to talk and be sensible, but it's causing quite a lot of anxiety out there.
OK, Nick, thanks very much.
Mark, how much the question runs, I'm not sure who this question's from, but how much closer are they to finding a cure for coronavirus? I mean, I suppose the better question might be a vaccine.
Well, let's take both of those. A cure, at the moment, there isn't one. We're still working on basically treating symptoms and supporting a patient's symptoms, so allowing the immune system time to get over the infection. And that seems to be working quite well. I mean, one thing that's not often mentioned, there's something like 62,000 people out of the 111,000 that have been infected who've recovered, and they recovered and gone home. Yeah. That's not to ignore the people who are left, but that's a real thing to celebrate. So the people can recover, and we are treating people successfully by supporting them during the course of the symptoms that they've got. There are some trials looking at certain anti-HIV drugs which seem to be working to stop the virus as well, because they've both got the same type of genome. It's an RNA genome, not a DNA genome, and that seems to be some rays of hope there. As far as the vaccine's concerned, if I'm honest, I think we're probably not going to have a vaccine for this outbreak, but we will have one hopefully for future outbreaks to protect people in the future.
And if you were one of those people who panicked the last time and bought a stock of Tamiflu, is it any good?
Probably not for this virus, I would think. I'm not entirely sure, but I think it probably wouldn't be. I think it's very important that they're focusing on these anti-HIV drugs at the moment to see if they can be repurposed and used in the coronavirus cases.
OK. Mark Fielder and our other two guests joining us from Glasgow and Central London, Iain Campbell and Nick Trent. Thanks all very much indeed for joining us today. More questions to come, I'm sure, in the days to come.
Yes, indeed. You're watching Sky News Today. Coming up, we're going to be crossing back live to Italy, now home to the most deadly